Good evening, my name is Gerhard Lauterbach. I'm a PhD student from University of São Paulo. My supervisor is Professor Milton, and today I will be continuing our discussion about preoperative functional capacity assessment. The objectives of our study will be the creation of a functional capacity questionnaire with cultural adaptation, and these adaptations would be not only for Brazilian population, but more specifically for the population of our hospital. We want also to measure the precision of the questionnaires by comparing them with the gold standard test, which will be the cardiopulmonary exercise test. And we also want to assess how much the schooling of patients interferes with their ability to estimate their own functional capacity by answering the questionnaire. We have the hypothesis that the patients with more schooling have a better ability to estimate their own functional capacity. The population of our study will be patients of more than 50 years old and a revised cardiac risk index of 1 or more. And these patients will come from the preoperative assessment outpatient clinic, but also from surgical wards in Hospital das Clínicas. And the exclusion criteria will be an important physical limitation, which would be an incapacity, would be impossible for these patients to perform the cardiopulmonary exercise test, but also decompensated comorbidities, which would contraindicate their surgery, and the incapacity to understand the consent forms. So, in short, the methods of our study. First of all, the patient is invited to participate in the study, and in the same moment, he answers the full questionnaire, and this questionnaire is applied by the study investigator. After that, in a second moment, the patient is invited to return to the hospital and perform a cardiopulmonary exercise test. The raters of the test, the cardiologist and the physiologist, they're both blinded to the answers of the questionnaire that was performed previously. And the precision of the estimation of good functional capacity will be assessed by each question and by combinations of questions, always comparing them to the cardiopulmonary exercise test. These are the references used for my presentation. Thank you for your attention. Thank you so much.